Hello, my name is Dr. Jennifer Kim, and I'm one of the board-certified sleep medicine physicians at the Pacific Sleep Program. You are watching this video in preparation for the sleep study. A sleep study, also called a polysomnogram, is an overnight study of your sleep, which takes place in a specialized laboratory called a sleep lab. It is conducted by a trained technologist and is designed to detect problems with your sleep. The goal of the sleep study is to have a natural night of sleep that is as uncomplicated and comfortable as possible. Before the sleep study, we recommend maintain your usual daytime schedule and avoid any physical exercise that you don't normally do. Try to refrain from naps on the day of the study so that you'll be able to sleep more easily on the night of the study. Have your evening meal prior to arriving to the sleep lab. Bring any snacks you would like to have. To prepare for the sleep study, you may wish to bring your own pajamas, robe, slippers, and personal hygiene items, including toothbrush and toothpaste, as well as any reading materials such as books or magazines. Loose-fitting clothing is preferred. Avoid leggings or silk, as these may interfere with testing equipment. Remember to bring any medications that you would normally take prior to bedtime and in the morning, unless otherwise instructed. If you have a preferred pillow, please bring it with you. Pillows are provided, but you are welcome to bring one from home. If you wear a CPAP or BiPAP mask at home or a night guard or oral appliance, please bring it with you. When you come to the laboratory, a technologist will greet you and show you location of the bathroom, bedroom, and control room. The technologist will check your height and weight and have you complete some questionnaires. In order to ensure that your room is at a temperature comfortable to you, please adjust the thermostat on the wall, as each testing room is individually adjustable. Extra blankets are available if needed. Our beds are sleep number beds, and we encourage you to adjust the settings to your desired firmness. As head of bed adjustment may affect our testing results, please do not raise or lower the head of bed without consultation with your sleep technologist. There is a camera in the room to monitor your sleep, as well as an intercom to communicate with the technologist. We encourage you to relax and get comfortable in your settings. When it is time, you will change into your night clothes and the sleep technologist will hook up the electrodes and sensors. This is not painful. The electrodes are metal and shaped like a tiny cup, about 1/4 inch in diameter. They attach to wires which provide us with electrical signals which can be recorded. Because the position of the electrode is quite important, the technologist will measure your head and mark it for placement. The scalp will be cleansed thoroughly in order to get a good signal. The electrodes will then be attached with either glue or paste. The technologist may scratch the scalp gently to improve the electrical connection. Electrodes will be applied at the eyes to detect eye movement. Electrodes will also be applied to the chin, as well as near the nose and mouth, to detect muscle tone and airflow when you are breathing. Belts will be placed around your chest and abdomen to detect movement associated with breathing. A sensor will be placed on your finger to detect your oxygen level. EKG sensors will be placed on the chest to detect your heart rate. Finally, some sensors will be attached to the muscles on your arms or legs to detect muscle tone. If you are planning to take a sleep aid, please inform the sleep technologist and they will instruct you as to the correct time to take the sleep aid. For best results, we recommend the following. Shower and wash your hair, including facial hair, before arriving to the sleep lab. Men should shave facial hair stubble, but a clean beard or mustache is acceptable. Avoid using hairspray or oils on your hair. Avoid temporary hair dyes in the week prior to the study. Please remove any weaves, braids, or wigs. Avoid acrylic nails or colored polish. Your index fingernail must be free of nail polish, including acrylic, gel, or shellac. Avoid using body lotion. Keep makeup to a minimum. As you are getting ready for bed, we ask that you turn off all electronics, such as phones and tablets. You may wonder if you will be able to sleep with all these wires attached. Most people sleep quite well. You can be easily unhooked whenever you want to move around and go to the bathroom, as the sensors are connected to a small box called a head box that you can carry with you. You should be able to sleep in any position that is comfortable to you. There are occasions when the electrodes may become loose and the technologist will have to come in and reapply them. Before starting the study, the technologist will have you go through a series of tasks, including closing and opening your eyes and clenching your teeth. This is to assist in calibration of the equipment to your emotions. If your study is used to detect sleep apnea, and you have evidence of moderate to severe sleep apnea in the first half of the night, the technologist may start treatment with continuous positive airway pressure, or CPAP. CPAP involves gentle air pressure administered to the nose or nose and mouth through a mask interface to help keep the airway from collapsing. In order to prepare for this possibility, the technologist may have you try some CPAP masks prior to the sleep study to see which type of masks are best if CPAP is applied. It may take a little getting used to, but it should not be uncomfortable. Please remember that if CPAP is applied during the study, this does not indicate that CPAP will be the only recommended treatment if sleep apnea was detected. Also, if CPAP is not applied, it does not indicate that sleep apnea is not present. The sleep study will end at 6 a.m., unless otherwise instructed by the ordering sleep medicine provider. After the study is complete, you will be awakened and the electrodes will be removed. There will be some adhesive on your skin and in your hair after the study. We recommend that you allow an additional 15 to 30 minutes to your morning routine to shower and remove the adhesive. For best results, use conditioner or a shampoo-conditioner mix such as Head & Shoulders and place some on each paste spot. Wait 3 to 5 minutes and then wash hair in a hot shower. Do not brush your hair until the paste has been removed, as it may spread to other hair, requiring multiple washings. Tape adhesive can be washed off with soap and warm water. If you have taken a sleep aid for the study, you may feel drowsy in the morning. If you have taken a sleep aid, it is recommended that you avoid any type of activity that may require you to be awake or alert, including driving a motor vehicle, as some sleep aids may impair your thinking and reaction time. Ensure that you have a ride available to contact, or that you inform the sleep technologist if you are unable to safely drive home. Once you have left, the work has just begun for your sleep medicine team. The record will be scored and analyzed and reviewed by the sleep medicine doctor, who will generate a report on the results of the sleep study. This process typically takes 7 to 10 days following the sleep study. A follow-up visit will be performed to discuss the results of the study and to generate a treatment plan. Pacific Sleep Program is proud to be an American Academy of Sleep Medicine accredited sleep laboratory. We look forward to providing your care at Pacific Sleep Program. Please review your sleep study scheduling paperwork for more detailed information on the sleep study, as well as information on your sleep study appointment date and follow-up appointment. Another resource you can look at is our website, pacificsleepprogram.com.